Hello world and welcome to Bipey Fox. Today I have a very, very, very special guest in the form of Dr Rajalingam. He runs Save Minds and his title is Consultant Intensive Care Medicine. Hello Yadu, how are you doing?
Hi Sam, very pleased to meet you.
We've met before Yadu, haven't we? Let's be honest.
Yes, indeed.
Do you want to say a little bit about how we met?
Oh yes, so Sam is a very intelligent young man. came to us for Save Minds to have some treatment, and it was all about Sam and how we structured our treatment with Sam, and I'm sure Sam you would better how you benefited from the treatment or what we gave you.
100%. Well, no, I think this is the thing, Yadu. I think it's best to probably just introduce Save Minds as a clinic. Obviously, you are the main man. And also, it's important, what I keep saying on the podcast is that this is all my experience and this is just how I have experienced life with bipolar. But it's nice to have a genuine doctor on the podcast to be able to say about, with your backing of saying about what what you do is, and you can talk about the science on the basis that you're a doctor. So do you want to just introduce what Save Minds is?
So Save Minds is the first psychedelic company, psychedelic treatment center, started in UK, and we are a private clinic. Based and focusing treatment on people with treatment-resistant depression and bipolar disorder. We also treat people with severe anxiety and PTSD.
What's the actual... Sorry.
Go ahead.
What's the actual treatment then, Yadu?
So what we do is that, we use a medication called ketamine, which is a very well-known anesthetic agent. On a very, very small dose to treat people with depression. And the reason why ketamine became medication for depression is that, ketamine works on neurotransmitter called glutamate, right? And the glutamate is one of the most important neurotransmitter for memory, for intelligence, for networking, and it is the neurotransmitter which occupies about 80 to 85% of the brain chemicals. Hitherto, all this time, people have been focusing on serotonin, norepinephrine, dopamine pathway, and the glutamate system has been neglected for such a long time. And from 2000, they realized that, there is something which we are missing in terms of treating people with mental health, with the common treatment of SSRIs, SNRIs, and their benefits being much less than hoped. And ketamine, being used appropriately in the right people with the right indication, can give 70 to 80% relief of their mental health within about 2 to 3 weeks of starting treatment. People who have been suffering from mental health illness for years, who have not got any benefit from the standard, recognized, established treatment, when they are started on ketamine, again, I have to say it's not everybody benefit from ketamine. There are indications where ketamine works best. It's like people with treatment-resistant depression, bipolar disorder, especially type 2, PTSD, anxiety. When we treat them, the relief can be rapid and quite unexpectedly very high. And that is where the ketamine now is. And actually, psychedelics is the future of treating people with mental health illness.
Amazing. Well, so if I sort of tell a bit of my story, I think hopefully one day I'll be able to get the doctor that introduced me to you on the podcast. That'd be great. But I think for now it's better just not to mention his name. But my private psychiatrist recommended me to Yadu. But there was a bit of an issue with that on the basis that we went down the the mainstream route of doing antidepressants, antipsychotics, anti-anxieties, and mood stabilizers, and they didn't work, right? So my doctor, after I actually asked him, I said, I've been doing research into psychedelics. He said, well, I'm working alongside Save Minds, and they were quite early in their referral process. And so I said, is that something that I could get involved with? Obviously, there's a lot of risks with bipolar. Do you want to talk about that, Yadu? Or there might be a risk. I mean, is there a risk?
Yes. So the issue with ketamine is that, ketamine gives a psychedelic experience, right, of well-being. It is a medication, but in bipolar, what the problem is that, what often we are worried about is to trigger mania, right? Now, bipolar is depression, mania, right? Goes, and I have to put my hands up, Sam. I'm not a psychiatrist.
Yeah,
right.
Course, yeah.
I work with ketamine, so in terms of anything which I talk in terms of psychiatric illness is that what I have learned and read over the last 3 to 4 years. So my knowledge is on that base limited. But the problem with ketamine, often what people are worried about is that in some cases it can trigger mania, where people who have predominantly mania rather than depression, if they will get better, but they may fall into the other category of mania, right? So what we have to do is, in those cases, we have to carefully, following the recommendation from the psychiatrist, we have to very carefully titrate the medication, right? Is just to treat the depression, but to prevent going to the other state of bipolar issue. So that is what probably we achieve with you, Sam.
100%. And that's, so from my experience with Save Minds, obviously I was working with Yadu, and it was amazing. I mean, Yadu there's a reason why I want him on the podcast, because he's so knowledgeable about what he does. But in terms of the way that he treats, he treated me, and I assume all of his other patients, is that every single step of the way was explained to a very fine detail. You know this, Yadu, and you knew it through the process, but it was quite scary experience for me, right?
Yes.
And that's the point. Like, I was scared to do ketamine in the first place, but it was at a point of desperation. But even throughout the process, it can, and I think that's important to maybe note, like, it is quite a scary treatment, would you say, Yadu?
Yes. For instance, Sam, right, the ketamine, the dose of medication which we use is a very, very small dose compared to the amount we use in anesthetics, right? Now, the scary bit of it is that out-of-body experience people experience with ketamine. Now, that is probably you were well prepared for that experience, right? And your psychiatrist well prepared you. You had a focus, you had a theme every time you came for treatment. We looked into it, and when you had the out-of-body experience, our focus was to think about that, to work on that, because with ketamine, you have a period of dissociation, we call, right? And that is sometimes very helpful for people to dissociate from the thoughts and processes which has been keeping them ingrained in their thinking, to dissociate from that and look that in a very different aspect.
100%.
Right?
Yeah.
And that is what you did. And that is what you very successfully, you were mentally prepared. Though the experience was scary, right, you were able to have a theme on each treatment, and you used it very intelligently to get the best results, which we achieved with you.
Well, 100%. And I think I said this on a podcast yesterday. I'm very reactive as a human, and I'm also I'm quite against the advice of authority or professionals or anything like that. And I think at this point where I'd come to Save Minds with you, Yadu, it was a point where I had to just accept that the professionals, I had to give the professionals my life in a way, and just say, this is what I need, and I have to follow the advice of the people who do it day in, day out. And I think the important thing was that my psychiatrist was telling me things to sort of take into the experience. You were sort of giving me another side of things. So I had a psychiatrist and then I had you. And I think for me it was so important as well, because I knew it was such a big treatment. I knew it was such an amazing clinic, which it is, by the way. It's absolutely amazing. And the experience, albeit scary, was very comforting because of Yadu and all of his amazing staff. But I think the point is I also wanted to give you something back. So obviously I think that's important. Well, I don't know, I know that you've never taken ketamine yourself, but obviously you've experienced a lot of people who are going through it, and it was very important for me to give you as much of the experience as I possibly could. And that's the point. Going back to the point about you were saying about, really tailoring the experience to each individual, like every single trip or treatment or whatever you want to call it was completely different. And I think the last two, because isn't it right saying averagely people have about 6 to 12 treatments? Is that correct?
Yes. So what we do is that, there's a minimum of 6 treatment.
Yeah.
Right? Why we keep that minimum of 6 treatment is that if it's the response to ketamine in terms of treatment is about 70 to 80%. Right? Now, being a private clinic, it is quite expensive. So what we tend to do, and the literature says that if you don't respond within the first 6 treatments, right, that means you come under the treatment failure group.
Yeah.
Of anything from 20 to 30%, can be slightly less or slightly more depending on individual and their circumstances. Mm-hmm. So we have a minimum of 6 infusion. And if that within that 6 infusion, if your treatment has been good and the response is good, then you may need a few more treatments with a view to slowly weaning off from the ketamine treatment, meaning that we have 2 treatments every week for about 3 weeks. And that is probably what we did with you, Sam.
Yeah.
Right? And then once, depending on the response within those 6 infusions or 8 infusions, then what we tend to do is to stretch the time between treatments.
Yeah.
The view to looking at the mood, looking at how it is sustained, hopefully by 8, 10 or 12, depending on the individual's response, we try to wean them off from the treatment.
Yeah.
Right? And about 50 to 60% of our people don't return back to us for any maintenance treatment because they have got back their life. They have gone back to university, back to work, and once they do one step, then the second step becomes easy and the third step becomes easy, and they get the confidence that they have got the relief and that they are almost on the verge of recovery.
Yeah. Oh, 100%. And there was someone who worked with you, again, like, I haven't spoken to her, so I think it's probably best we don't mention her name, but there was someone who worked with you and with me as well at the early stages of my treatment, and she'd actually had the treatment as well, right?
Correct.
And she had been very unwell, and then essentially had 8 months of being very well, and actually some of the things that she said to me, she very thoroughly prepared me for the experience and the treatment, but she also said she's been actually fine for the last 8 months, and what she actually said was it wasn't a case of she's never had a bad day or she never felt sad or anything, but she felt a normal sense of sad like we all do, sometimes on a daily basis. There might be something that happens in your day that just makes you a bit sad. You might remember someone that's died, or you stub your toe, things like that happen in day-to-day life. And I think it's important to remember that, like, the ketamine treatment isn't going to make you never be sad again or never be happy again. It's just going to, for me anyway, it put me in a state of mind that I hadn't been in for 14 years, and I'd almost forgotten what that felt like. And actually to have it back, I always describe it, Yadu, and I don't know if I've said this to you, but it was almost like I had a crash helmet on with the visor down, and someone had just taken the crash helmet off. The difference was incredible. But as I say again, like, the treatment was challenging. I think that's the best thing to say. Like, it was challenging. Like, there was some very extreme highs and some very extreme lows throughout that whole process for me, just going through it all. But the end product after just 2 weeks was absolutely phenomenal. It's changed my life. I wouldn't be doing this podcast now if it wasn't for the ketamine treatment. That's 100%. you know, it really focused my life and focused my thoughts on what I really wanted to do in life to keep myself well and happy and just live a free life that I never even dreamed of. Because it got to a point with bipolar, and I'm bipolar 1, as I've said before, Yadu, obviously you know that as well. But it got to a point where I was just going to accept the fact that